So one of the biggest problems in our space, and the sad thing is it's been a problem for a long time. So this isn't new. And the problem is that you get hospitals and health systems that are receiving correspondence from, could be payers, could be vendors, right? They're receiving it from a number of different entities and all types of correspondence. So they may get faxes, they may get abrasive phone calls, they may get emails. Those emails may have, correspondence in the body of the email. They may get spreadsheets. And in a lot of cases, they're getting this correspondence 2, 3, 4 times. So it's duplicative. May go to the different people, may go to the wrong person. The bottom line is that we are several decades into receiving basically the same types of abrasive correspondence to these providers. They can't keep up with it. They can't track it, they can't report on it, and that all rolls up into, right, they can't resolve it. And so the problem you have is you have these people that are suffering at the hospitals, not responding to timely this correspondence they're receiving from these payers and vendors, which results in these payers and vendors not getting whatever response they're looking for. It could be an overpayment refund, it could be medical record review, whatever it is, they're not getting the response they're looking for in the time they're looking for it. And so everyone is suffering because we can't come to terms with what a proper, consistent solution is in, 2024. Well, what's interesting is that I do feel like you can get small wins with hospitals and health systems. You can get small wins with payers and vendors. You get them to get past that adversarial relationship of who's on the other side of the coin, right? And they do start to collaborate with, hey, what if we, just received your correspondence in one consistent format? Now, maybe that's still an old format, right? It's not real-time technology, but at least it's coming consistently from the same person at the other side of the table, and I only have to converse with one person. So it does seem like when people are ready to collaborate with another human from the other side of the table, we're able to get small wins. It's not going to solve the problem, but it inches us closer to a resolution. I think what solves the problem is that consistent model. So we talked about the small win happening in a consistent format. You need that consistent model. We're in 2024. Like, how that's not happening in an online portal that a provider can log into and converse in real time about different types of correspondence with different entities on the other side of the table, right? So now they may have one process with this plan and a separate process with this plan. Let's get all those plans into one application. Let's get all those hospitals and health systems into one application and get them conversing in real time with a user on the other side of the table. If you could find one portal, so a hospital or health system or a payer has to log into one portal to handle all of their correspondence, it's taking away enough of their pain, their suffering. Maybe they're willing to come to the table to pick at that adversarial relationship or downgrade it, right? Like, maybe that's enough to bring them to the table with the other side. They can start to come to terms with that relationship. People on either side of the table of these adversarial relationships need to come together. They need to collaborate on what that solution is. I mean, I feel like we can get there. People got to open their minds, right? And I think vendors are in a good spot to help with that. I don't know that all vendors are unbiased, but there are vendors out there that are working with both payers and providers and sit in this really unique space to help facilitate some of that collaboration. And I don't think we get enough of that collaboration. I think we need more kind of safe spaces to do that, right? Where we're not selling to either entity. We're discussing, we're collaborating on what's an overriding solution that we can come to.